Okay guys, hopefully you survived that lengthy previous video on the overhead squat assessment. So I hope it will make sense. If it doesn't, if there's anything you're not sure of, please message me in the email address below and I'll happily answer any questions. I know it's a lot to take in, especially if you're not a fitness professional. I'll try to make it not too technical, trying to explain the basics of it. So hopefully that come across well. If there's any bits you're not sure about, please message me. So what I'm going to do in this video, we're going to start on the release technique. So we're going to target the muscles that are contributing to, in this video, if you had an anterior pelvic tilt, if you had the excessive forward lean, if you had knees bow in or as well, and you noticed that when you did the modification, those signs didn't go away. So you put your heels up, it didn't get better. Your excessive forward lean was still there. The anterior pelvic tilt would have been there anyway. The knees bow in was still there. You even put your hands on your hips, on your pelvis. The anterior pelvic was still there. So that's a sign that it is definitely coming from the lumbopelvic hip complex. Okay, knees bow out. We go a slightly different route. The weight shift as well, we go a slightly different route as well. I'm going to do a separate video if you had those signs. So knee signs, if you had knees bow in, excessive forward lean, anterior pelvic tilt, that didn't get better with the modification, you're going to watch this video. If you had knees bow out, you watch that video. If you had the weight shift, again, you watch that video. So I'm going to make separate videos for the different signs. So there's a few different paths we can go, but the main one, so what we need to do first is our release technique. So you're going to need your foam roller. You may be able to use a ball. It might be a bit aggressive for some of these techniques, but I think a foam roller would be a safer bet. So with the release techniques, if you've seen the other videos I've done on them, what we're doing here, we're targeting the muscles that become short and overactive. So these are the muscles that have got tight, that are being overused, that the body is preferentially recruiting over other muscles. So other muscles have shut down. So in this case, with those signs, it's mainly going to be our hip flexor muscles. It's going to be our muscles on the inner thigh, the adductors, the muscles that rotate our femurs inward and pull our knees in. So our adductors would, if you had that knees bow in sign, they would pull our knees in. Also the internal rotators of the femur, so they're the muscles which would also kind of make these knees kind of collapse inwards. These muscles also, so our hip flexors, our internal rotators, and our adductors also contribute to that anterior pelvic tilt. So they pull down that anterior superior iliac spine, that ASIS I mentioned before, and they increase that lumbar curve that we had before if you had those signs. So that's what we're going after these. If you had that excessive forward lean like I do, and it didn't get better with the heels elevated, that's the sign that the hip flexors are pulling down on the torso into that hip, because this would be hip flexion. They're pulling down on the torso into that flex position. Okay, so that's why we're doing it. So what we need to do is go after the hip flexors. There's a couple we can't get because they lay deep within the stomach. So our iliacus is actually on the inside of the, that's one of our main hip flexors on the inside of the pelvis. We can't get to that with these tools. The same with our psoas, which is another major hip flexor. Attaches from the front of our pelvis up to our spine. It sits underneath our abdominal muscles and under some viscera. So again, don't go shoving foam rollers and balls in towards your stomach. If we did these interventions, which are usually more than effective anyway, if it still didn't get better, then you may have to see a manual therapist because they would have to do that. So if I can get someone to do these interventions, it didn't have the effect I wanted, maybe I'd go in, because I'm a manual therapist, I'd go in and manually release those muscles. But don't worry, we can still do an awful lot. If we can't get to them, that's no problem. I just wanted to make you guys aware, don't put that in your stomach, it's not nice. So what we can do, so we're going to go after the other hip flexors, the other adductors, the other internal rotators, which I was just talking about. So we're going to start with the foam roller. We're going to go after a muscle called our TFL, our tensor fascial lata. It sounds a bit like a coffee, but it's not as nice as a coffee. So what we're going to do, we're going to put the foam roll in that front pocket area. So imagine where your front pocket is. So it's going to be on this side. I want you just to lean forward, kind of roll in on yourself just a little bit. And then what we're doing, if you watched other videos I've said about the foam rolling, we're not just going to do this. We're not just going to roll up and down. That's not going to do anything. This isn't a rolling pin. Our muscles are not dough. We're not rolling out a pizza, okay, a pizza base, even though that would sound amazing. But we're not doing that. So what we're going to do, we're going to roll through. We're going to find, we are going to roll through, but we're only going to do it until we find a tender spot. So an area of hyper irritability, get my words out. So a tender area, okay, you're going to find that point and you're just going to stay there. You're not going to move. So when you're doing this, the rules are, okay, make sure it's somewhat uncomfortable. It's not excruciating. It's not causing us so much pain that it's uncomfortable. We're having to like shake and go, because all that's going to do is our muscles that they're releasing. I would say if I was doing my TFL, if it was too much, if it was too intense, my TFL is just going to contract, it's going to guard, and I'm never going to get a release. I need to relax. I need to make sure that that muscle is calming down, it's in a relaxed position, it's not tensing up. Okay, so I just find that point, make sure I can bear it, I can manage it. You know, I should be able to sit here all day. Okay, and then what should happen from 30 seconds to 2 minutes is you should feel a reduction in intensity. Okay, so you should feel like that, like there's a release that's happened. That's what we term release techniques. You should feel like that irritability is diminishing, it's going away, it's nowhere near as tender as it was before. So I've done that, I can't feel any tenderness now. Okay, and then I can move on. So all I'm doing there with these release techniques, I'm just targeting those overactive muscles, those short ones, and I'm calming them down, because at the minute when they're short and overactive, they've got an increase in tone, an increase in what we call neural drive, so they're very active. What these do is they calm down that activity. And again, if they have a lower level of activity, they're much more easier to address when we do our stretching techniques, and also they'll stop inhibiting our weaker muscles. So our weaker muscles for those signs I was talking about earlier is going to be our glute muscles primarily, which we're going to activate a bit later on in a future video. So for now, we do these techniques to calm down those overactive muscles to try and reduce their activity. So that's our TFL. The other one that we're going to need to do is the rectus femoris. So that's this big muscle down the front of our thigh. So it's one of our quadricep muscles. It's also a hip flexor. So what we need to do there is we're going to lay on the front. We could do both at once, or we can do one at a time. And again, I'm going to start just below that ASIS that I was talking about a lot earlier. And I'm going to roll all the way down to just above my knees. And I'm going to look for a tender spot. Now the tender spot tends to be a bit higher up. It tends to be kind of closer to the pelvis, that ASIS. Okay, so I'm going to go through, I'm going to find it. I've got one there. So what I need to be careful of, if you can drop your knees down, great. If you can't, don't worry. Maybe you need to put a pillow or something underneath it. And what we don't want is just, again, anterior pelvic tilt, because that's what we're trying to correct, right? So we don't want to release in that position, because we're not going to make anything any better. It's going to defeat the object a little bit. So we don't want that. We want good form. We want neutral pelvis, neutral spine. So if you do need to prop yourself up a little bit, that's absolutely fine. If it's more effective with your legs straight, just make sure that your form is good. Okay. And it's the same thing. I'm going to hold it, find that tender spot, hold it 30 seconds to 2 minutes, or until I feel a release happen. As soon as I get that reduction in intensity, which I'm getting, I can move on. So that's my rectus femoris. So that one's better now. So I've done those. So I've done my TFL, I've done my rectus femoris. So what else can I do? Well, I said before about my inner thigh muscles, my adductors, they get short and overactive with those signs. So all I do there, again, I'm going to lay on my side, lay on my front rather, and I'm going to bring my knee up, okay, to as high up as I can get it. So the roller is now directly on the inside of my thigh. I'm going to lay down, make sure I'm comfortable, and then I can just scan through, find that tender spot. They tend to be kind of closer to the knee, or or about halfway up. And I've got one right there. And again, I could just lay down and just relax. I'm comfortable. I'm not straining. I'm not having to, it's not so intense that I'm guarding up. I could hold this all day. It's a bit uncomfortable, but I can manage it. It's no problem. And I'm just going to wait there, again, 30 seconds to 2 minutes until it goes away. And then as soon as it goes away, I can then move on. So there are main three that we're going to do. Okay guys, the other muscle to release, so we did the main ones were going to be our hip flexors, and I said about the muscles in the inner thigh and also the muscles that turn the femurs, the thighs inward. The other one that we need to do as well is our outside hamstring, so our lateral hamstring. So it's this muscle down here. Because I said before about if our hip flexors get short and overactive, as long as with the other muscles, then our glute muscles shut down as well, and as a result our hamstrings will try to take over the role of the glutes, which it doesn't do a very good job of. So a lot of you may have that feeling of tight hamstrings. In that case, if we do have like an anterior pelvic tilt where the spine is the pelvis is tilted forward, our hamstrings actually on stretch. They're not actually short, they're actually lengthened, but they're under a lot of tension, so they will feel very tight, but we don't actually want to stretch them. What we want to do instead is actually release them. So again, you're going to get your massage ball or a tennis ball. And I'm hoping you guys can see this, because you're going to need to be sat on I'm doing it on my sofa. I have the world's smallest chair as well, so this was the best thing to use it on. So hopefully you guys can see. But yeah, have a chair or somewhere where your legs can dangle. Maybe you have a kitchen stool. And we're going to take the ball, and what we're going to do is just feel the back of your leg. You're going to feel like a big, wiry tendon, okay? Okay, so you're going to feel that. If you kind of tense your leg up, if you kind of push your heel back towards the sofa, you should feel that muscle tense up along there. So that is your lateral hamstring, known as your bicep femoris. So I want you just to trace it about halfway up for me, okay, about halfway, and then you're going to put the ball under that spot, okay? So I hope you guys can see this. I've got the ball, you can just see I've got the ball there on the outside of my thigh, okay? And I'm going to look through. I might have to strum a little bit side to side, and then boom, I've got my tender spot. And you should run into them. It can be a little bit tricky to find, but you should run into it. I've got a tender spot there, okay? And again, just like my other release techniques, I'm just going to find that tender spot, make sure I can manage it. It's not too uncomfortable. Hold it 30 seconds to 2 minutes or until it goes away. Okay, so that's an important one to do as well. So make sure your legs are dangling or you're seated down. At least so you're in that seated position, your knees are bent. I wouldn't try this on the floor. It's very hard to find on a foam roller. I find this is much easier to find. It's much more effective to get a release as well. So this is for the lateral hamstring. So it's those four. So we did our rectus femoris, we did our TFL, we did our adductors, and we did our bicep femoris. So we did those 4 releases. So they're going to be your main releases to do. Okay.